Hola y muy buenos días a todos. Gracias por conectarse a esta sesión informativa virtual de la
This
OPS.
virtual session of PAHO on pandemics for COVID-19 in the Americas region. I'm Sebastian Odiel from the Communication Department of PAHO. This session, as usually, will last about 45 minutes to 1 hour, and we will have questions from you at this moment. We have already received questions by email, and you can make live questions by chat by the button UEI. You have to include your name and your communication means when you ask your question. I also remind you that when we have simultaneous interpretation to English and to Spanish. Today, the PAHO director, Dr. Cadiz Etienne, will talk about the epidemiological current situation in the region, also about the new antigenic quick diagnosis that can transform the answer to COVID-19. We will follow Dr. Carissa
El
in
doctor
this session. Dr.
director del
Carosa of PAHO,
de la
Ciro
OPS
Ugarte, Director of Health
de
Emergencies of
incidentes para COVID-19.
WHO, and Dr. Aguirre, Commander for Incidents in PAHO. We will call to the floor. Dr. Etienne, please, we pass the floor to you.
Thank you, Sebastian. A very good morning to all of you who have joined us for this press briefing. As of the 13th of October, there have been more than 18 million COVID-19 cases and more than 590,000 deaths reported in our region. The state of the pandemic in the Americas remains complex. Canada is currently facing its second wave, and areas that were not previously affected are now surpassing the numbers seen during the first wave, with the most populous provinces of Quebec and Ontario contributing the most to the country's death toll. Over the past week, we have also seen a high number of cases in the English-speaking Caribbean, as well as in some of the Dutch territories, like Bonaire, Curacao, Aruba, and St. Martin. In many countries, the pandemic has also moved to less populated areas. In Guatemala, for example, the Department of Petén has experienced a threefold increase in deaths, and the Department of Tarija in Bolivia has the highest incidence rate in the country. Cases in Argentina also continue to accelerate, reaching up to 16,000 cases per day during the past week. Since the pandemic began more than 9 months ago, we have known that to beat the virus, we must transform our public health response. We need public health measures to prevent community transmission. Fast, accurate, and affordable diagnostic tests to determine when someone has been infected with COVID-19. We need new medicines to help COVID patients get better, and ultimately, a safe and effective vaccine. Today, I am happy to report that one of these breakthroughs has arrived, and it could very well be a game changer for our region. Slowing the spread of this virus rests on our ability to figure out early when someone is infected. At the individual level, accurate testing allows us to better manage patients and prevent the virus from infecting others. At the community level, it allows us to track changes in the virus's spread and to adjust our response. A multitude of rapid diagnostic tests have flooded the market since the pandemic began. Many of them are fast, some are cheap, yet few have been reliable. So that's why the PCR diagnostic tests, which are highly accurate and must be conducted in lab settings, have remained today the gold standard. Yet the Americas contains a rich diversity of landscapes including urban centers and remote and had to reach mountains, deserts, and islands. And as cases have increased, our centralized laboratories have been really flooded with samples, causing many of those tested to experience significant delays to receive their results. As patients wait for test results, they carry on with their lives. They go to work, they take public transportation, and visit family. This means that for days or even weeks, they run the risk of infecting their loved ones, their co-workers, and their communities. And this is exactly how a virus spreads out of control. But thanks to the tireless work of the WHO's ACT Accelerator, we now have an affordable and reliable diagnostic test that can be performed anywhere. By providing results quickly, the new test empowers frontline health workers to better manage cases by isolating patients to prevent further spread and to begin treatment immediately. And it gives healthcare workers, whether they're working in a hospital in Buenos Aires or a mobile health clinic in the Amazon, it gives them the power to test and diagnose cases within minutes, not days, at 1/3 of the cost of the traditional PCR tests that we have been using. These new diagnostics will allow us to test more people faster and more accurately than ever before, particularly in remote communities without easy access to a laboratory, which have been disproportionately impacted by the pandemic. If distributed widely, this new test will transform our COVID response. Today, PAHO has in its possession hundreds of thousands of these tests, and we have those available via the PAHO Strategic Supply Fund, with millions more expected in the coming weeks. So we have built up a stockpile, and we are able also to access those tests for our member states. As these tests are being rolled out, PAHO has begun helping countries implement new testing protocols so that health workers know how to use the new diagnostics and to report their results. We are also excited to announce that PAHO is conducting pilot studies with Ecuador, El Salvador, Mexico, and Suriname. In the case of the study in Mexico, PAHO will closely collaborate with the Ministry of Health and the World Health Organization. With support from WHO, we will be providing these diagnostic tests free of cost as we keep a close eye on how they're used. The data collected via this study will help countries within and outside of our region make the most of these new diagnostics. Let me repeat. I really believe that this new rapid diagnostic test can be a game changer for the region of the Americas. I urge our member states to partner with PAHO to bring these new tests to the hospitals and health clinics on the front lines of our fight against the virus. But it is important to remember that no single innovation is a panacea. That's why it remains critical to stay the course in every aspect of our COVID response. We must continue to adhere to public health measures to prevent the spread of the virus. We must continue to test and isolate cases and trace their contacts to prevent new infections. And we must continue to let data underpin our actions to prevent any new cases from spreading out of control. We must also remember that innovations cannot have impact if they do not reach the people who need them the most. To capitalize on the power of this new diagnostic, countries must make them available and accessible to everyone, irrespective of who they are or where they live. And we must do that to bring us closer to our promise for health for all. Thank you.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. We have already received questions by email, and also we're receiving questions through the chat. Remember to write in the Q&A your question with your name and your procedure in order for us to coordinate and organize the questions, and also to pass the floor to people who may answer your questions in the Q&A. The first question that we have many questions regarding the testing. Among them, Francisco Moreira from Argentina. And
regarding the new diagnostic test, are there any limitations with this technology? Should the new test replace all other tests in use today? Doctora Etienne?
Thank you, Sebastian. So let me begin by saying that it is really important to understand that PCR tests are and remain the gold standard for COVID-19 testing. So while we are very excited about the possibilities that these new tests present, it is important to emphasize that they do not and should not replace PCR testing. The new tests are a type of antigen test. This means that they detect specific proteins of the virus, which we call antigens, and can therefore identify someone who is currently infected with COVID-19. Prior to this test being developed, we could only truly rely on PCR tests, which, while they are hugely reliable, require high-quality samples and sophisticated equipment. This type of equipment was only available in a limited number of laboratories, and samples had to be shipped under controlled conditions from collection sites. For remote and hard-to-reach areas in our region, this means that it can take many days for results to become available. For several months also, rapid diagnostic tests have tried to bridge these gaps, but until now, these have all been antibody tests, which are different. While an antibody test can show whether a person has had an infection, they are usually negative in early stages of the disease. This means that rather than take measures to isolate themselves, someone with COVID-19 could test negative and continue with their normal life, potentially infecting others. So that was with the antibody test. While the new rapid antigen test will not replace PCR tests, and they are not intended to be used for testing of travelers, they, however, will allow us to test for active infections faster than ever before. This enables primary healthcare workers, whether they are working in the middle of the Amazon or in an urban center, to diagnose and care for patients immediately, stopping further infections in their tracks. And that is what makes it the game changer. As countries in other regions experience an increase in cases and reintroduce stricter measures to reduce the impact of a second wave, including lockdowns in some cities, we must continue to ensure that we use these antigen tests, these new diagnostics, to help us fight the virus and to reduce the transmission in our communities. Thank you, and over.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. Following question that we have received a lot of questions about the testing, and we will talk about them later on. A question that we received from Daniel Collins, journalist from TM23 in Guatemala, and he says that in Guatemala, in many regions, they are in the cattle sample to have contact with COVID-19, and what consequence we have. The herd they're trying to have the herd contamination. Thank you for your question. The immunity, the herd immunity or collective immunity is a concept that we're using in general for the vaccines. It's a concept that if you reach a specific number of people that have a vaccine in the community, these people will protect the people that have not received the vaccine. This has a variation. It depends on each vaccine. For example, for measles vaccine, 97% is required. For other vaccines, it could be 90% or less. We never have used in public health a strategy for herd immunity with a natural infection by a disease. Why? Because the consequence of this is to promote the infection in such a way that the number of people that will be sick will require hospitals and intensive care and ventilators also, and that will die is much greater than a number that can be obtained with social distances measures and other measures to prevent the disease. We do not know of someone in the region that is officially using a strategy that, as we have said, is not a strategy, is a tragedy, because it will produce thousands of deaths that could be avoided. Besides that, there's no evidence, no proof to say which is percentage of the population that needs to be in contact with the virus in order to reach a collective immunity. There are a lot of articles written, but even in cities like Madrid, for example, that has reached more than 15% of infections, the prevalence of infections during the first wave in February and March. Now they already have a second wave. So it's not a strategy can be accepted under the technical point of view and under the ethical point of view. Thank you. Thank you. The following question, Cecilia Salomon, AP agency. Her question was PAHO concerned with contagious actions in Bolivia? Have they been in contact with the authorities? Have they given any special recommendations? Sebastian, this question is very important because many countries have gone through election processes and others are organizing election process. So PAHO, through its regional offices and in the office in Bolivia, they have worked and they have cooperated with the United Nations team in the country and someone in the name of the Secretary General and from other political bodies in order to grant specific measures to the national authorities. And also PAHO at the national level, together with other functions, have given alignments for election processes that have been communicated, have been applied by observers groups and also as in support to national bodies for the elections in these countries. We have solved through this mechanism many uncertainties that have been given through safety and security measures during election period, and PAHO has called the public to pay attention to all the information given by the national authorities that are specific guidelines for the Bolivia election process. However, we have been concerned by some political manifestations where many people have been seen without masks or without keeping a social distance. But in the last weeks, we have seen that people are improving following the recommendations, and we hope they continue like this during these election processes for the elections of October 18 until November, and in case it is necessary, a second call for the elections. I want to highlight there are other countries in the region of the Americas that are in this same process. In all the cases, PAHO is giving recommendations to reduce the risk of people that are participating, but also for people that are supporting the election process. We're talking about the juries and supervisors of the armed forces, of the police, and other groups that will give support to the election. So we wish that the population in Bolivia will vote and at the same time will protect their right to health and life.
Thank you, Doctor. The next question will come from Matias Loewi from Netscape. In Spanish, he asks, do you expect an increased growth in your region in the 29 years old age? Nowadays, it's 20-25%. What would be the relevance more than the diminishment of the mortality rate? Dr. Aldigueri, please.
Muchas gracias por esa pregunta.
Thank you for your question. In fact, in the Americas of the region, we have a number of epidemiological situations. There are many differences between the subregions. In some countries, indeed, we have noted, or rather, we are actually noticing an increase in the number of cases in the age 2029 group. But to generalize this or do this throughout Latin America and the Caribbean is a step perhaps somewhat different. That does not mean that this situation is applicable to all countries. In other regions in the world, such as Europe, indeed, this trend has been noted. For instance, in Europe, during the summer that has just finished, we had this case, but what we have to be clear about is that we have demographic pyramids that are totally different between Latin America and Europe and the Caribbean, with populations that are far younger in our region. What is certain is that this age group has fewer comorbidities like diabetes and hypertension, and this means fewer complications for patients that will reach medical services or emergency medical services. But this population moves faster, lives in more packed conditions, if you will, and especially in student environments where perhaps there are some limitations with regard to the application, the disciplined application of health measures. So what we would like to do is a call, is an alert for these populations to as to their responsibility, their social responsibility, so that an index that could be increased in this population does not lead to contamination to other age groups. I'm referring to family members in their residences, and particularly the elderly, the grandparents. Thank you.
Doctor. Vamos a pasar ahora a...
Thank you, Doctor. We will now have some questions from the chat. And the first question is from Valeria Heredia from El Comercio from Ecuador. She says, the Ministry of Health says that there are requirements to enter the COVAX initiatives. Could you elaborate further as to these requirements? Dr. Barbosa? Yes, indeed. Thank you for your question, Valeria. The COVAX mechanism has over 160 countries. In our region, almost all countries have adhered. And what is the great advantage of this COVAX mechanism? Well, it is in the fact that it involves a process of negotiation with all producers that are on stage 3 of the clinical trials.
Tener una vacuna lista para la utilización. Como la negociación de COVAX es con una...
So it's to improve the negotiating conditions. So the possibility of having vaccines is far greater than if a country alone has negotiations at bilateral level with only one producer. It might be the case that this one producer that is engaged in these negotiations is not able to develop the vaccine soon enough or quickly enough, or at good standards of safety and efficacy. Unfortunately, all producers or vaccine manufacturers are requiring an anticipation to reserve doses of these vaccinations, and several web countries have already allocated millions of doses, or they have bought millions of doses, and so therefore to have the capacity to make this reservation of these vaccines for at least 20% of the population of each country, and all of the countries, of course, will require anticipation equivalent to 15% of the vaccines that will be made available for this first stage. In the case of Ecuador, this would be somewhere around $11 million. Of course, the OPS, we are negotiating with the financial institutions, for example, the Inter-American Development Bank, to anticipate this payment. We are also negotiating with donors in the European Union and other mechanisms, because this anticipated payment is important to make it possible for the COVAX to have the decision to make the reservation from all producers, so that when the vaccine is ready, we are able to have equitable access to all the countries in the region, which is the purpose of COVAX. Thank you very much. Thank you very much, Dr. Jarvis. I would like to give the floor to Alia Brix of CBC News Barbados. Alia Brix.
Good morning, everyone. My question is for Dr. Etienne. In tourism-dependent countries like Barbados, there's been an influx in visitors testing positive upon their second COVID-19 test. Barbados's current travel protocol states that visitors from high-risk countries must present a negative PCR test upon arrival and will only be allowed to leave quarantine after 5 days after presenting a negative test. So medical practitioners across the island have expressed concerns that some cases may slip through the cracks based on the possibility of false negatives or travelers who contracted COVID between their initial test and the time that they arrived to Barbados. So my question is Barbados's retest protocol an effective way of testing visitors given the virus's incubation period? And as countries like Guyana are taking steps towards reopening their borders, what is PAHO's suggested travel protocol?
Thank you, Alia. Dr. Ugarte, could you take these questions?
With pleasure. Thank you, Alia, for your very timely question, because most of the countries are, after a long period of lockdown or closing borders, they are resuming international travel. And for Barbados and many other Caribbean countries that are reopening or are resuming non-essential international travel like tourism, for all of them implies accepting there is a risk. And defining the level of tolerance to that risk implies that if the risk is high, then the countries may consider continue either closing their borders of subjecting the incoming travelers to a 14 days strict quarantine period. However, tourism wish to have a pleasant experience and enjoy their stay at their destination, and being quarantined for in a foreign country is unlikely to constitute an enjoyable experience, but also it will, of course, reduce the likability of the tourists to go to certain countries. Or similarly, relying on testing to stimulate tourism presents major and substantial limitations of biological, epidemiological, logistics, and also of legal nature. So as PAHO, we are very much aware of the needs of tourism-dependent states to reactivate their economy. And the advice that we have especially offered to the government of Barbados is to consider focusing on efforts on monitoring the health status of incoming tourists for the first 14 days of their stay, and to consider doing so in partnership and in great collaboration with the tourists themselves, but also with the hotels and the tourism industry at large. Obviously, PAHO's advice is framed in a context where tourists and the local population adhere to the protective and hygienic measures and physical distancing because those measures must be respected at all times. We are also seeing that investing in measures like testing generates false sense of security. When you get a test, and that test has been taken several days before, the results are good for the day that the test was taken, not for the day that you received the results. So many things may have happened between the moment that you got tested, and ultimately, of course, lead to a non-sustainable and non-effective use of resources. So we understand the challenges that the government may face when it departs from measures that the community thinks that are protective. The community feels that they are secure when the incoming travelers have been tested, but that is a false sense of security and are not cost effective and would require a very well and thorough communication exercise to communicate to the community on that regards. So what's said about Barbados also applies to other countries, neither relying on quarantine nor testing to resume non-essential travel. Also applies, of course, to Guyana and to any other country in the Americas. And the advice was formulated by PAHO last week after the directing council, the ministers of health of the Americas met and requested specifically PAHO to develop a document with recommendations or considerations on non-essential travel. And that document has been published and is being used by many countries, and we are in close contact with several governments in order to adjust their requirements for travelers, particularly international travelers and tourists, when reopening the economy. Thank you.
Muchas gracias, doctor.
Thank you, doctor. I would like to give the floor now to Carmen Pound to do her or ask her question.
Yes, thank you so much for taking my question. I have a question for Dr. Etienne about the rapid test that she was talking about at the beginning. Are this part of the 120 million tests that the WHO announced, I think last week, that they will be sent to countries all over the world? And can you tell us if there's just one producer of this test or more producers? Like, who are the producers of this test? And a bit about the rollout. Have they already started being rolled out, or when do you expect to start rolling them out throughout the region? Thank you.
Gracias, Carmen. Doctora Alighieri, usted que lleva en detalle este tema, podría...
Dr. Alighieri perhaps could answer this question.
I will switch to English. The question was in English, so I will answer the question in English. Yes, this is part of the WHO announcement by the WHO Director General of the World Health Organization recently. And as mentioned in the remarks of Dr. Etienne, it has been one of the products of the ACT Accelerator for providing the countries with new tools for the fight against the virus. The validation of this new test goes through a very strict validation process with the intervention of a WHO collaborating center called FIND. And as of today, 2 tests have been validated from 2 different manufacturers, have been validated by the WHO collaborating center. We're expecting more tests to be screened and validated by the collaborating center and going on the market in the coming months. But we have already these 2 tests. In the PAHO region, yes, we are starting the rollout of this test. We have in our warehouse based in Panama, the PAHO warehouse in Panama, enough tests for starting pilot studies in 4 different countries that were mentioned by Dr. Etienne, in El Salvador, Ecuador, Suriname, Mexico. Also, test has been procured, rapid antigen test has been procured through the PAHO fund for Venezuela. I know this will help a lot in expanding the laboratory capacity in Venezuela, together with the network of laboratory in Venezuela. So what we expect, I'm expanding a little bit on this question, it may answer other concerns from other colleagues, journalists, is that PAHO is building a stock. PAHO is doing some field pilot together with countries, but we are expecting countries, member states in this region to procure this new test through the PAHO Strategic Fund. So it's a combination of national investment and also PAHO donation. I hope I have answered the concerns of the journalist. Over.
Gracias, doctor. Gisela
Thank you,
Salomón.
Doctor. Gisela Solomon has also some questions. Gisela, the floor is yours. Well, my question has to do with the crises specifically. To have this clear, right now we have 4 countries that are implementing a pilot program with these new tests. And then we will have through an initiative through where governments have to purchase these tests. Could you elaborate perhaps, or could you explain how this fund works in order to acquire these tests? Thank you for your question, Gisela. It is a combination of the several mechanisms that you have mentioned. Pilot studies have indeed, so for us to understand the new complicated points of primary care in remote zones, complex zones, and indigenous populated zones in the interior of the Amazon, that is the purpose of the pilot tests, to identify the characteristics that change the settings for these diagnostic series of tests. And then as an initiative of PAHO is to build an inventory, an emergency inventory that will allow us to address precise situations in countries in the coming weeks. And this inventory is on the buildup as we speak. Some remittances are on their way as we speak towards this deposit in Panama. Furthermore, we have close contacts with several countries so that they are able to purchase through existing mechanisms, which are the same mechanisms that we have for ordinary medicines for tuberculosis, to HIV and other diseases that have not been properly taken care of. So therefore, it's a combination of all these mechanisms, and we're hopeful that in the coming months and weeks to expand this diagnostic capacity focused in primary attention and care to alleviate the load that exists currently, as mentioned by Etienne, for PCRs tests that remain the golden standard for diagnosis purposes in the region and other regions in the world. I hope I have answered your question.
Following questions regarding the vaccine, Matias Ewewi from ESCAPE in Spanish, he asked if PAHO is concerned if you have candidates for vaccine that demands less than 70 centigrades for its conservation, and what's logistic issue for it to be conserved in your region when it is available. Thank you, Dr. Barbosa. Thank you for your question. Yes, of the 10 vaccines that we have in the stage 3, we have one vaccine has a new technology that uses genetic raw material of the virus, and this vaccine will require some changes that are important in the supply chain in some countries. Demands to be conserved at less 70 degrees centigrade. The other 9 vaccines use technologies that may be used with the code change that the countries have. So a COVAX mechanism is being working, and the proposal to have this, the countries may choose which vaccine is better adaptable to their own reality. The field chain preparation draws the attention that you have a vaccine campaign. It's not necessary only to have the vaccine. We, through the rotation fund of vaccines of PAHO, we are also doing all the internal preparation of the syringes and other materials that are going to be used, and we're supporting the countries in the region. This week, we already have research in all the countries in the region regarding all the details and issues that are necessary to comply with the preparation of a vaccine against COVID-19. Since the communication, that is to inform correctly the safety issues to the population, and also preparing health professionals, also how to review the supply. So all this huge package that we're giving to the countries in order for them to be prepared when the vaccine is ready, and for them to use it in the population of their own countries through the national programs of immunization. Thank you, Doctor. The following question in the chat comes from Lilia Lopez from Nicaragua Press. She says, 7 months afterwards, IMISA has shown a campaign where they dictate drastic measures for prevention, considering the behavior of the virus in the region and the context of each country. Is this sufficient, or it is in compliance with the situation? And we asked PAHO, do you have had a response to a complete situation of Nicaragua? Thank you for your question. The Nicaragua government has recently stipulated some protection measures in many sectors that I think that are better aligned with the original recommendations of Pan American Organization for Health, PAHO, and specifically regarding health services in schools, in shops, and working places and offices and so on. It is necessary to consider these recommendations because we have the feeling that we have less cases, and we feel that we don't have to protect ourselves, and we think that the problem is over. But COVID-19 will be with us during a long time, and it's necessary to increase the measures for protection, mainly when we have this feeling that it won't end, because it won't end. And in this sense, in order to have a detailed analysis with precision and give specific recommendations for Nicaragua, we require reports and information regarding the locations, the type of population, the times, the number of testing, the capability of your services, and many other issues that we expect that the Nicaragua government will inform us and will share with us, which will allow us to assess, to have a direct analysis. Thank you. Thank you, Doctor. We have many other questions regarding the testing. Some doubts continue. Douglas Macachan from Jamaica Information Services.
Did it become officially available? Otros periodistas, por ejemplo.
Another journalist, for example, Karina from Venezuela, she wants to know if this new test will be sent to Venezuela as well. The same, Paraguay, it's being asked also. Dr. Silvan Anigueri, please. Thank you.
Question from Jamaica. And 2 different manufacturers are producing the 2 tests that have been validated at this moment. Okay. One of the manufacturers is based in Asia, The other manufacturer has plants in Europe and the United States. These two tests have been validated by the WHO Collaborating Center between early and late September. And as I told you previously, we are expecting more tests going through the very strict validation process of the WHO Collaborating Center. Cuanto a la pregunta de Venezuela, yo creo que lo había comentado antes, sí.
Regarding the question of Venezuela, I think I was mentioned before through the PAHO channel, the quick test for the detection of antigens have been granted and have already arrived at Venezuela. And our team in Venezuela is dealing with this very closely with the national lab chain in order to give priority to this in Venezuela. Regarding the question of Paraguay, we are in direct contact with the National Lab of Reference in Paraguay, and we have had sessions in order to explain the mechanisms in order to obtain the tests. And we're waiting in Paraguay as well as other countries, the same kind of contact between people of the lab and also the contacts in countries in order to acquire, to have the procurement of these new testing. Thank you. Thank you. Javier Verdejo, Radio Santa Maria in Chile, he asks, does it continue being recommended by PAHO as quarantine mechanism for the control of COVID-19? Is it effective, Dr. Barbosa? Thank you for your question. Well, quarantine for the individual level and the social level are very, very effective. For the individual level, if there is a case of COVID in their context, they have to be all in quarantine in order to avoid the transmission. The detection, the early detection of the case is correct detection, and the contacts and families continue being one of the most effective recommendations in order to detain the dissemination of the disease. For the social level, I believe this is one of the great lessons that we have learned during this pandemic. For the first time, we had a confirmation with scientific evidence about the great effectiveness of the measures of social distancing that have been called social quarantine or whatever that each country has implemented according to their own reality, to their own characteristics. So it is not a recommendation that may be applied in all the parts of the same country. It has to be applied according to the dynamics of the transmission of COVID-19. But there are a lot of studies already that are being held, just to mention one, in the city of New York. If the measures of social quarantine that had been strictly adopted during at the beginning of March, at the end of February, if they had been adopted 2 weeks before, we could have avoided about 36,000 deaths. So I think this and other evidence have been have highlighted the importance of the social distancing and the quarantine measures, as some people call them, when the transmission is increasing, when it is growing so much, the number of infected people. If we don't adopt the social distancing, the health services will not be able to offer beds and ventilators for the severe cases that will require this. Yes, it continues being a measure that has to be followed among many other ones according to the reality of the transmission is being passed in the country, the province, or municipalities of each country. Thank you, Doctor. The following question, the chat from Mariana Soquet for Cocuyo in Venezuela. He says that Venezuela has no people, no tourists, and we're intermittent quarantine each week. Many Venezuelan people are abroad, and the restriction to flights continues. What do you think about the extension of these measures in Venezuela? Thank you, Sebastian. As I mentioned previously during a question about reestablishing the international flights, we have to do this considering the capacity of each country and the risks of each country. In the case of Venezuela, we all know the capacity of the health services. It is necessary to strengthen it in order to face a great number of cases. And if you decrease the social measures, this would not happen. And in this sense, I think the government of Venezuela is taking the correct measures in order to diminish the curve. And we also have a decrease in the mobility in Venezuela due to lack of fuel and other issues that could also have contributed of this decrease in the curve. So it is very important that each country and each situation, like the case of Venezuela, you analyze the capacity of the health services. How is the transmission going regarding the virus? And in this sense, we can take the correct measures. I would like to mention that we will still have a great gap between the sample taking molecular testing and the results of these testing that is about 2 weeks. And that's why, regarding the agreement that we signed with the health services and the National Assembly, PAHO has acquired antigens testing, that is the issue of this conference, that are already there in Venezuela that will allow to decentralize this testing with 20 teams with very quick results, and 10 of these teams will not, he's talking about devices, equipment, sorry, and it would not require electricity, which is as scarce in Venezuela. So with this information, we will be very near to the momentum of the sample taking and to understand better the situation and intensify the protection regarding where this testing is being done and how we are looking at the health services, which many places it has a great number of people that be in the hospital, others less. We have many other questions regarding the testing from Valeria Heredia from Ecuador, Aline Diaz from RGP. Valeria Heredia is asking how many antigens testing have reached Ecuador in this pilot plan, and if you know if they are already being applied or when will they arrive and what is the date. And Lina Diaz from FEP asks that Dr. Jen mentioned in her words that a great amount of quick testing inundated the market at the beginning of the pandemic, but very few were reliable. So she asks how this new antigen testing is different from the previous ones that are in the market already, and why are these antigen testing going to be reliable? Doctora.
Thank you.
Thank you for both questions. I see that we have to answer in English, but I have to answer in Spanish. Well, I will answer in Spanish both questions. Beginning with a question from a colleague from Ecuador. The testing have not reached Ecuador yet. The testing for Ecuador have reached our stock in PAHO in Panama. The important in Ecuador, we have to mention that we're working very connected with authorities and the lab networks in order to implement in 7 priority areas in Ecuador, which is we consider as a pilot plan to work with Ecuadorian colleagues with population, indigenous people population and Afro-descendant in remote zones of Ecuador. We're talking about the provinces of the western region of Ecuador and also provinces from the Atlantic side of Ecuador. Regarding the question of Mrs. Alina Yestri to IFP, this is not a PAHO testing. This is quick testing available through the mechanisms of procurement and pilot projects with the participation of PAHO. It's a bit different. This testing has been validated by Cooperation Center of WHO that is called FINE, that is located in Switzerland. And in this state today, 2 tests have been validated by this cooperating center, and we expect more that are ongoing, and we hope more will be introduced in the market. Then afterwards, the comments of Dr. Etienne, we make a difference between quick testing that have come in great, huge amounts for the detection of antibodies, blood testing, pricking of the finger. These testing have not been recommended by PAHO for regarding the use that they have been given in our countries. These quick testing for antibody testing have not resulted to give good surveillance and don't cover the initial moments of the disease. That is, the patient may have antibody negative response and to be an infected patient regarding their family, their colleagues, and friends. The antigen
rápida de antígeno
the quick antigen testing, on the contrary, allow us to focus how this testing, the PCR testing in the asymptomatic patients. I hope I have answered your uncertainties. Thank you. Thank you. We're coming to the end of our briefing. We have some other questions. One that have from Noah Higgins Dunn from CNBC. He says,
Canada. Officials in Ontario warned the outbreak in the province could reach levels like New York City and Italy early in their outbreaks. Does PAHO share those concerns, and do you believe more lockdown efforts need to be taken to prevent further spread? Dr. Barbosa, could you take this question?
Yes, thank you for, for this question. In
countries, thank you for your
the US or Brazil or Mexico, we really have seen since the beginning of the pandemic that there is this kind of a movement between one state to another state, from one region to another region. So it's very important that the national and local authorities, they need to monitor very close the situation, because you can change in some provinces or states, you can have the decrease, the transmission have been controlled, and in other provinces or states, you can have an increase, and the dynamic is totally different. For this reason, they need to adapt the response. This is exactly what the local authorities are doing in Ontario, adapting their strategies, calling the attention, and reminding the population that there is an increase, a very important increase in the number of cases, and if they don't follow the recommendation that they are providing, probably they can see a scenario similar to what happened in New York and in Italy. This is the good recipe to deal with the pandemic, is to have a very good surveillance system, so you can rely on the data, you can have the trends that are happening, if they are increasing, if they are decreasing, and adapting your strategy to the situation that you are facing. Thank you.
Gracias, doctor. Última pregunta. Hemos recibido varias.
Last question. We have received many about the outbreaks regarding the zones and recommendations. So the question is,
experience an increase in cases and reintroduce stricter measures to reduce the impact of a second wave, including lockdown in some cities. What are PAHO recommendations regarding public health measures? Have they changed at all? Dr. Etienne?
Thank you for this question. It is true that in recent weeks and days, we have seen many countries and cities in the world, and particularly in Europe, experience new waves of transmission after having relaxed their public health measures, such as lockdowns, reopened schools, and partially resumed non-essential travel. As I mentioned earlier, we are also seeing spikes in cases in our region due to some of the very same reasons. Here at PAHO, we are very aware that beyond the huge impact that COVID-19 has on people's health throughout the Americas, the pandemic has also unleashed an unprecedented economic and social crisis, with job losses, school closures, and people unable to visit family and friends. And so we also recognize the fatigue that this generates and the toll that it takes on all aspects of people's lives, including on their mental health. The public health measures that we recommend for individuals, which includes hand washing, physical distancing, cough etiquette, and mask wearing, remain the same. And workplaces and other areas must be adapted to allow for the application of these measures. However, as we highlighted in our joint report with ECLAC in July, the implementation of community-wide restrictive measures should be data-driven, as you just heard Dr. Barbosa said, and it should be also as geographically targeted as possible. It should be implemented in the local areas where community transmission is taking place. And again, as I've reiterated numerous times before, they also must be accompanied by social and economic measures so that people are not forced to make decisions between their lives and their livelihoods. It is important to remember that our health remains at the very center of everything we do. And as long as COVID-19 remains in transmission, individuals and countries must continue to implement the recommended personal and public health measures that prevent health services from becoming overwhelmed, but importantly, that keep ourselves and our loved ones safe. Thank you for being with us again today. Over.
Muchas gracias, doctora Etienne. Ahora sí.
Thank you, Dr. Etienne. We have reached the end of our session. Thank you to all of you for having participated. Very soon we will send you the words of our director and also the recording of this session. I remind you that you can continue in contact with us through your questions by email. You can also find more information in our webpage of PAHO. Thank you very much to all of you and have a good day. Thank you.